Hello, my name is Kiri Westbrook, and I'm one of the health coaches here at HealthMed. And today I'm going to be talking about stress and mental health so that you can recognize it in your own life and also know what to do when you recognize it in those around you. Stress is something that we all experience pretty much on a day-to-day basis, and it's not necessarily a bad thing, but stress is just your body's response to everyday threats. It's what you feel when you have more to handle than what you're used to. Um, so the right amount of stress can actually be a good thing. It can get your body ready for the task at hand, so it can make you more alert, which can prevent a mistake or an accident. It keeps you on your toes for presentation. It motivates you to work hard. And also, that flight or fight response is actually a good thing when you're in a dangerous situation. So, if a car is coming at you real quick, that flight or fight response kicks in and you have all this adrenaline rush to help you like quickly react or have more strength than you normally do. So that way you can handle what's happening. But what the bad thing is when excessive stress happens in your workplace and just in your everyday life when it's not needed. When you have too much of it, it can impact your physical health and also your personal relationships. So stress has a lot of negative effects on us mentally and emotionally and physically. And so one of the biggest negative effects is with our health, especially our heart health. So too much stress, like I said, can be harmful over time. So, if we ever come in and take your blood pressure and it's really high, we might say, are you having a stressful morning or did something bad just happen? Because being stressed, even though it seems to be an emotional response, is also a physical response. Your body is physically responding to that stress that you're feeling, and so it can cause or worsen health problems if it's something that's happening over time. So some of those things it can cause or worsen is a suppressed immune system, depression or anxiety. It can either help bring it on and manifest itself, or it can, if you're already experiencing it, can just make it worse. It can cause sleep problems. It can increase your risk of heart attack or stroke. It can also worsen pre-existing autoimmune diseases. It can cause a flare-up with one of those. So the situations and the experiences that cause stress are known as stressors. So stressors can be something bad or they can be something good. So if you lose a job, if you lose a loved one, of course that's something bad that's happening that can cause stress in your life. But also, good things that happen in your life, like life changes, like getting married or moving. All those things are positive things generally, but they just, add extra responsibility and pressure that you may not be used to. And so even something good in your life can still cause stress. So stress can also be brought on by how you perceive the things that are happening to you. So you can feel stressed by, external things that are happening to you, or you can feel it or, worsen that stress by the way that you're perceiving the things that are happening. So some of those external stressors, those things that are happening around you, some of those examples are health problems. This is a pretty big one. About 1/3 of individuals with a chronic disease or condition experience depression, whether that's just the weight of having a chronic illness or, illnesses can also change the chemistry in your brain or the medicine you're taking. So there can be a number of reasons why health problems cause stress. Major life changes can cause stress. So again, major life changes can be good or they can be bad, but either way, they can be stressful. Also, having a busy schedule. If you're someone that has a hard time saying no, or if you're just in a season of life that is extra busy, that can cause stress because you're just feeling overwhelmed, like there's too much to handle, and you're not having time to really, take some deep breaths and look at the big picture. You're so caught up on, all the demands that you're trying to meet right now. Um, Relationship strain can cause stress, whether that's with your family immediately or, non-immediate family, or at work or close relationships, friendships. All you have so many different relationships, and so relationship strain can definitely be an external stressor. Work can also be an external stressor. If you're, if you have fear of, job security, if you're working long hours, you have pressure to meet expectations, if you're not getting along with your superiors or your coworkers, all these different things can cause stress. Family stress kind of goes back to that relationship strain. And then, moving is just an example of one of those major life changes that can cause stress. So kind of think through maybe some different examples in your life of external stressors so that you can be aware of them, and then also be able to think through which ones you can do something about and which ones you need to just take some time and process so you can handle it better. So like I said earlier, there's two different things that can bring on stress in your life. And so that's external stressors, what we just talked about, things that happen outside, that happen to you. And then there's also internal stressors, so the way that you're perceiving and handling the things that are happening to you. So again, think through this list that I'm talking about, and see if you can recognize any of these things in your own life or any other examples of how you experience internal stressors. So some of those examples would be pessimism. So if you are just, negative self-talk, but those kind of go together. So, things are happening to you, and they might already be a bad situation, but then you're also, kind of brewing it up in your head and not handling it very well. Just, if you have a flat tire, yeah, that, is hard, but then you're also thinking through and kind of blowing up in your head how bad it is. And, you could have taken it in with a better light and made the situation better, but instead, you're brewing in your head and making it worse. Unrealistic expectations can be an internal stressor. So if you're expecting something to be a certain way, you have very high hopes for something, you're always, looking for the next thing in life. And then when it comes, it's, doesn't meet your expectations because you're kind of, you know, dreaming it up, or you just weren't communicating with the other people involved. So really just, not being pessimistic about the future, but also just, enjoying what your, life is right now, and not having unrealistic expectations that in the future something is going to, make this all better. And then when you get there, you're stressed because it doesn't. And then also a fearful or worrisome mindset. Some of us are just more prone to this, or things in that have happened to us make us more prone to have being fearful or worrisome. But there definitely are some coping techniques, and you don't have to always think this way. You can rewire the way that you think and the way that you talk to yourself, and that can really help. So I really liked this point at the bottom. It said your outlook in life plays a major role in how well you handle external stressors. So it's the things that happen to you. You can't necessarily control that, but you can control the way that you perceive them. So like I said, we all experience stress, and therefore we all cope with stress in one way or another. It has to be coped with, whether that's in a positive way or a negative way. So that first quote, I also like this one. It says, your body feels stress-related wear and tear in two ways: the stress itself and the unhealthy ways that you respond to it. So I'm going to go through a list of negative coping techniques, and then I'll go through a list of some positive ones. So for this one, again, just be thinking through, do I recognize any of these techniques in my own life that I need to change, or are there any others that aren't on this list that I also see myself doing? So some of those negative coping techniques would be substance abuse, really numbing the problem or just turning to something else, ignoring the problem. That's a big one. There is stress and there are hard things that happen in life, but ignoring them doesn't make them go away. It almost even makes it worse in the long run. Stress eating, or on the other hand, not eating enough, lashing out because you're on edge, compulsive shopping, trying to get your mind off of it and, make yourself happier for a moment. So all of these different examples of negative coping techniques, they're all just a quick fix for stress. None of them actually helps you work through what's going on. And so it's not solving the problem. It's just trying to put a Band-Aid on it. But really underneath that Band-Aid, the wound is festering even more. And so we're going to go into some of those more positive coping techniques to really deal with the problem at hand so that you can move past it. So some positive coping techniques that we can use to cope with stress. One is learning to say no. So this is a big one if you feel like your schedule is too busy and that is really adding to the stress in your life. Not everything that we're doing on our schedule right now is probably necessary. There's probably a couple things in there that even if you're committed right now, maybe next year you could say no to. And then, if even though you're not doing everything and your plate isn't super full, that way you can, invest more deeply on the things that you are saying yes to. Another good thing is to look at the big picture. So if you're really busy, you're really stressed out, you're thinking about the things that are happening today, that are happening tomorrow, and you're not really thinking past that. So just taking some deep breaths, sitting and thinking about the big picture, and think, a month from now, a year from now, 10 years from now, does this matter? Is this thing that's stressing me out, is it worth my time and my energy? But if I look at the big picture, does it, kind of put it in perspective? Another great coping technique is to ask for help. So a lot of us might think that, asking for help is a last resort option. You only ask for help when you're in a really bad place, but really, just asking for help when you feel even just a little bit of stress can help it from, becoming something much bigger that you can't handle. And then lastly, just taking care of yourself. A lot of us might feel like taking care of yourself is a selfish thing to do. You're taking time away from all of your other activities and taking care of others, but really you can't take care of others or do those other things if you're aren't taking care of yourself first. So by taking care of yourself, you're going to be able to do all those things better. So different ways to take care of yourself and relax is to exercise. You know, not everyone might view exercise as a way to take care of yourself or a way to relax, but once you get into it and get a routine, you get those endorphins flowing, it can really help your mental state. Doing something that you enjoy and finding a hobby. So whether that's being outside and going on hikes, or if you really enjoy reading or crafts, things like that, having something that you can just relax and do and be passionate about can really help. Connecting with others. So, going out to dinner or coffee or, walking with someone and just connecting with them. We're humans and we are relational people. We need to have that relationship aspect. And so we need to connect with others and that can also help us process the things that are going on in our life. And lastly, getting outside, especially now the weather's getting nicer. Getting outside can really help you get some fresh air and clear your mind. So I just spent a good bit of time talking about stress, and stress is something that we all experience pretty much in day-to-day life. But now I'm going to move into talking about depression and anxiety. They're both kind of thrown around together, but I'm going to take some time and define each of them separately. So starting off with depression. Depression is a common medical illness that negatively affects how you feel and how you think and how you act. So pretty much it causes feelings of overwhelming sadness. It can cause a loss of interest in activities that you're once passionate about. And symptoms are usually severe enough to cause a noticeable difference and problem in your day-to-day activities. And like I said, depression is a common medical illness and it affects approximately 14.8 million American adults. So that's depression, and then moving on to anxiety. Anxiety is having a feeling of worry, nervousness, or unease, and it's normally about event that's coming up or something that's going to happen that has an uncertain outcome. So anxiety disorder can manifest itself in a lot of different ways. So it can manifest itself in panic attacks and increased heart rate, increased blood pressure. So an anxiety disorder develops when your stress response becomes exaggerated or out of proportion. So I talked about that flight or fight response and how it can be a good thing because it can, get your body ready to act in a hard situation so that you can maybe even survive in something that is stressful. But anxiety disorder happens when you have that same response to something that is very out of proportion. So when you feel that same thing you feel when a car is coming at you when you're just sitting at your desk or when you're just in a room full of people. There's a number of different causes and reasons why depression and anxiety might happen. And in most cases, depression and anxiety won't have just a single cause. A lot of times it's a result of a mix of things such as your genes, things that have happened to you or things that you're going through now. So some of those common causes would be genetics. There definitely is a genetic component to both of these things. Gender, women are 2 times more likely to become depressed. Your age, you might, at certain ages, especially due to hormonal changes, you might be more susceptible to experiencing depression or anxiety. Health conditions, again, it can either bring it on because of just the overwhelming fact of having a disease or the traumatic experiences that you've had in the hospital or something, or it could also just be the fact that it's changing the brain chemistry. Trauma and grief, so the things that you experience can bring on depression, anxiety. Changes and stressful events in your life, it can really pull the rug out from under you and might be the trigger for depression or anxiety. And then also medications and substances can cause symptoms of depression and anxiety. Alcohol and substance abuse is common in people who are experiencing depression. These are some symptoms of depression and anxiety. Sometimes, some of the symptoms might overlap, but there are some clear differences. So for depression, some symptoms you might notice is the person withdrawing from other people. If they're becoming less social, if they're not opening up to people, if they just feel very withdrawn, that can be a symptom. If they're feeling feelings of overwhelming sadness, hopelessness, or emptiness, they can experience a reduced appetite, weight loss, or again, the opposite of that, having increased cravings and weight gain can be either side. They can have trouble thinking, making decisions, and remembering things. You're in this fog, and your brain is, depressed and it's sad, and so it can be hard to put mental energy into making decisions, and they can feel unimportant and just have that lack of desire to make those decisions and remember things. And it can also cause thoughts of suicide. And then anxiety, on the other hand, some symptoms with that would be restlessness and a feeling of being on edge, uncontrollable feelings of worry. So they're thinking about all the things that could go wrong, or even just a feeling of worry. There may not be a reason. There may not be thoughts of specific things that could go wrong. It's just this overwhelming feeling of worry, whether there's a reason or not. Concentration difficulties. So again, your mind is so caught up in all these different feelings, and you're kind of in this fog or in this weightiness that it's hard to put mental energy into different tasks at hand. And then also falling asleep, problems falling asleep or staying asleep. So we wanted to go over the definitions and the symptoms of depression and anxiety. So again, you can recognize it in yourself if you're experiencing that now, or if in the future you might experience it, and also so you can recognize it in those around you. But there are things to do to get help. There's hope. You can do something about it. So if you're experiencing any of these symptoms of either depression or anxiety, for sure contact your family doctor, and they can refer you to a mental health professional. If you ask around and you might know already on hand a mental health professional, you can do that. But oftentimes you can explain to your family doctor specifically, I'm having these symptoms, and I think it might be linked to this specific experience I have that I had. They might know a mental health professional that specifically, deals with those types of situations. So, feel free to go ahead and contact a mental health professional directly. But a lot of times, family doctors will know specifically, which ones might, be better suited for your case. Talk to a loved one. And so this is kind of twofold. One, it helps you to verbalize what's going on and talk through it with someone, but then also you're just making someone else aware of what's going on. So, and a loved one, they know you and they know what's normal for you. And so if you let them in on what's going on, they can also kind of keep an eye on, if you're acting funny one day or if something's off. It's just really good to have someone else in the loop that sees you day to day. And then of course, if you think that you might harm yourself, you can please call 911 or a suicide hotline immediately. And then with work, you can ask about your EAP, and there can be help there. So thanks for listening, and I hope that this really helps a lot of people recognize within themselves and those around them how they can help and what to do, both with stress and depression and anxiety. So thanks for listening.